know you can move your kneecap? And it's super important after surgery, after a knee surgery of ACL, meniscus, or any other surgery to the knee. It's crucial to have and make sure that your kneecap moves just like your other side, to make sure it moves adequately, because it's crucial to normal function of the knee. If that kneecap is not moving like it normally should, the actual mechanics of knee extension and flexion do not occur correctly, and it causes more problems getting full range of motion, both in flexion and extension. So let me show you exactly how I mobilize the kneecap, and to make sure that the normal mechanics of the kneecap are occurring, so your knee is very healthy and you have a successful recovery. Okay, so here's my kneecap, kind of a sesamoid bone here. And so in order to mobilize my kneecap and make it move like I'm doing right now, my knee needs to be 100% relaxed. If you find yourself tensioned, your kneecap will not move. Okay, so be 100% relaxed. Okay, so the normal mechanics of the knee, you need to be able to go up and out. We call it a superior lateral direction, kind of that way. That's how we do knee extension. See, as my knee, as I extend, my kneecap goes just like that. It goes a little bit to the side and a little bit up. Superior lateral direction is the name of it. Then we're going to go into flexion. When I bend my kneecap goes down and in the opposite direction of extension. So those two motions are very important with normal knee mechanics. If you're not having those occurring during those motions, that's not a good sign, because it means that you're probably not going to get full range of motion, and it might be uncomfortable to move the knee. So what I like to do initially, just to check the motion, make sure things are moving, I like to go side to side. I want to go as far as it'll let me. I got to push. You got to be a little aggressive here. You should feel that kneecap come way off to the side. Vice versa, going the other direction. You got to push. Okay, it shouldn't feel like you're stuck. Like if I'm like, hey, I can't seem to get it going anymore, that's not a good sign. We gotta keep moving it and mobilizing it more and more, just to get the kneecap to be nice and fluid. And it should be easy to move, just like this, up and down. It shouldn't be hard. If it is hard, it means you have some restrictions. Your tissue's not moving as good as it could. So you gotta keep mobilizing so it's nice and loose and easy to move. Okay, so we have our side to side. And then next we have our up and down. So you want to kind of find the borders, push up. You want to find the borders from the top, push down. Okay, both those. I like to do a few in each direction, maybe 5 to 10 initially, just to get it moving. Then I go up and down, 5 to 10. And then I go in circles, clockwise and counterclockwise. I kind of go up and around. Going around, it kind of looks ugly. Knees don't look pretty. Good, I go all directions. I do that a few times, probably like 1 to 2 minutes, and then I focus on those specific movements we talked about earlier, where I bring my knee up and out. I'm kind of pushing from the bottom, and I'm assisting with my other hand, pushing up. And you should feel it move. If you don't, you might have to push a little bit harder. Finding the kneecap can be hard sometimes, but once you find it, try to move it. You should be successful with it. This one's down and up. So again, just doing this for about 1 to 2 minutes. Try 1 to 2 times per day just to get the kneecap moving really well. You notice that this motion helps the knee move, the joint-wise bending and extending. It helps all motions. So definitely very beneficial and important to do post-op.